Right. Talking about spread, could I turn to Prof. Su and ask you, as an epidemiologist, do you see any trends in the way COVID-19 is spreading around the world?
I think what is clear and increasingly clear is that the epicenter of the epidemic, which is a pandemic in all but name, has spread away from China and has moved to other parts of the world. So we are seeing cases spreading to the Middle East from Iran, and we are seeing cases appearing in the rest of the Europe as a consequence of what's happening in northern Italy. In fact, China itself is seeing cases imported outside of China, back into China from overseas now, and that's the primary source of cases for China outside of Wuhan.
But what does that really mean? So if the epicenter has moved, is it now more dangerous? I mean, you're talking about Iran and Italy, so do we now have two epicenters?
Actually, what we are likely to see is that more and more countries worldwide will have an increasing number of cases, and they may in turn start exporting these cases overseas. So what it really means is that for those of us who are hoping that the epidemic will end by April or May, I think those hopes are going to be dashed, and we have to be prepared for a much longer course for this epidemic.
Yeah, that's bad news. Coming on top of what Health Minister Gan Kim Yong said in Parliament recently, he said that COVID-19 is here for the long term. And the question everyone is asking is, what does long term mean? Are we talking about a few more months? Are we talking about a year or more? Or are we talking about forever here? Who could maybe Prof. Pang, if you could, do you think it's going to be here long term?
I can imagine three scenarios. Okay, basically, the first one is, as Liang said, more countries will have outbreaks, including severe cases, so it becomes a continuing emergency. The second possibility is like SARS. There is maybe an outside chance that the virus will just disappear completely. I mean, that's a second possible scenario. The third one, which Liang already alluded to, is that the virus becomes endemic, and it's something that will stay with us, like the H1N1, the swine flu. And as one of my colleagues said, the way we should look at it is normalize everything, learn to live with the virus. That third scenario, I think Mike Ryan from WHO is sort of thinking along the same lines, that it's going to become endemic, it's going to be part of our sort of daily existence.
It's not easy to actually determine what the trajectory of this particular epidemic is going to be like, because it depends pretty much at several levels on what happens. It's starting to occur in many different countries, and the test really is how well each individual country is able to control the outbreak within its own borders.
Exactly.
Because if it's successful in doing so, there is a prospect and a chance that in fact we might be able to get a grip on this particular outbreak.
Sure.
We might be able to prevent spread across borders, and we might then ease into a long-term setting where it's there. It may flare up with the occasional cases, but it's manageable with each of our individual healthcare systems.
Sure.
The concern really is even if we have a strong healthcare system and we are able then to control what happens within our own borders, but you have neighbors, other countries who have strong travel links with you, but who are less successful in being able to contain this particular outbreak in their own countries, and that this very constant and regular feeding of cases that occurs into your healthcare system that then takes place. Then you end up with a situation where not quite a troubled peace scenario, not quite the scenario where it's a rampant outbreak out of control in many countries, but you have the very constant and perennial risk that you have imported cases occurring, and with each case, if one is not vigilant, each case then has a prospect of then spreading and forming clusters, and that may in fact be the sort of situation that many countries would face.
I noticed.
I just want to come back to a few points that Tiki had just mentioned. First of all, he mentioned about the speed. Second, he mentioned about unprecedented situations, and then he mentioned about the scenario. Personally, I think that the second scenario painted by him, it's just like SARS. We are able to push it back into the animal system. I think that likely is not something that's going to happen with this very new form of coronavirus. Then I'll come back to in terms of the speed. So, the distinct difference between this coronavirus, COVID-19, compared to the SARS coronavirus is that the disease patterns is very different. And we also realize that the patients with the infections, they secrete the virus very differently. During SARS, we know very well that the patients will take time for them to accumulate the virus in the respiratory system, and they were only able to secrete a lot of viruses in their respiratory system near the end stage of the clinical illness. And therefore you have the window of opportunity to be able to identify them and isolate them. But for this virus, it's very different in terms of behavior. It tends to be very mild, and it tends to be having a lot more virus being secreted during the early phase. So it makes this containment, or rather to able to control them, become a very difficult task. So I think those are the characteristics of this virus that we have to bear in mind. How are we going to look in the trajectory of the future epidemic?
So essentially what you're saying is even mild cases can spread the disease. They don't have to be very sick to spread the disease. So therefore it's more difficult to catch.
Right. I mean, we have published these informations looking at the 18 cases, and we continue to accumulate this part of the knowledge. We realized that the virus secretion is much, much higher in terms of the level during the early phase of the clinical illness.
Right. Now, you know, Singapore has been doing quite a good job in keeping the numbers down. But looking at what's been happening in Korea, in Italy, in Iran, you know, these countries have had a sudden jump in cases. And I believe you people have mentioned also that since it's a novel coronavirus, nobody has protection against it. Can Singapore expect such a sudden surge?
Well, the answer is yes, and it's very important. Therefore, we need to always be vigilant about this. A surge in cases can occur for a variety of different reasons. One, of course, is that it could be a situation where you have many cases coming from countries outside your border as a result of high numbers of community spread within those countries, and we are an international air hub. It's difficult for us to close all our borders, and therefore travelers coming from other countries may similarly still come to Singapore. But what is important is that once a case occurs, if you can detect that early, you might be able then to stop any further spread. But as Eason has mentioned, many patients with COVID-19, in fact, have very mild disease. They don't even think they're very sick. They carry on with their social activities, they go off to work. And when that happens, there's always that potential then for spread to take place. And therefore, if they present late to the health system, then the unfortunate thing is that many people then get exposed. And therefore, one case, two cases become a cluster. And the cluster becomes big if we are not able, therefore, to detect or to control that particular spread.
Yeah,
So
I mean, just to add to that, it's not just mildly ill people who are shedding the virus. As Yishin mentioned earlier, asymptomatic and pre-symptomatic people are also able to shed the virus.
Is that proven that people who are not symptomatic at all?
There is some evidence that asymptomatic and pre-symptomatic people can shed the virus. And I'm sort of shedding some recent data from Gabriel Leung in Hong Kong, made a presentation
and
a few days ago.
I think Liang is agreeing with Tiki.
Yes, I mean, the data does show that patients can be asymptomatic and test positive for the virus. But I think the jury is still out whether these people can transmit the virus to others.
So where the evidence, and the reality is we are still continuing to learn more and more about this virus and its infection as time goes on. So what we still don't know is how much, how infectious a person would be if one is asymptomatic or, as you say, pre-symptomatic. Certainly, if that were the dominant part of transmission, we'll be seeing a lot more cases internationally and even in Singapore itself. So we think that there's a risk of spread. We don't know exactly how big that is, but the dominant spread would still be in patients who are symptomatic, spreading by droplet, contamination of surfaces to other people in close proximity to them.
Right. Now, Liang, you mentioned earlier that it's a pandemic in all but name. So you think it's going to get very much worse? Because pandemic, by definition, means it affects large populations in many parts of the world.
Yes, I think increasingly we are starting to see that. We can see the cases start to mount in many countries. Even a country like UK, for instance, has now stated that they will go into mitigation mode rather than containment mode. And when many countries start doing that, then what they are essentially saying is that they want to protect their health systems from being overwhelmed, but they don't really see that it is possible to contain the virus anymore.
Right, mitigation mode. Can we talk about that? If, from what all of you say, one of these days, Singapore may see a big jump. I think, Kenneth, you mentioned that also.
Yes.
So if that happens, what happens to our DORSCON Orange?
Well, DORSCON Orange is a risk assessment system. We've used the DORSCON system to assess what the risk is of community spread in Singapore. And clearly, when we recognized that was in fact occurring, we moved the DORSCON level from yellow on to orange, previously from green to yellow. And that's where we are now. But the measures we take are based on the assessment of what we need to do. It's based on the assessment of the risk. It's calibrated. And in fact, we put in quite a number of measures even when we were at the earlier DORSCON stage, and then fine-tuned it as we went into orange. The way things are going, this disease, COVID-19, it's not going to be going away in 1 month, 2 months. It's not going to be going away in the summer. Singapore has summer all the time, and we see COVID-19 at this stage. So we have to be mentally prepared that it's going to be here for months, if not even as a new normal. It's always going to be there with us. What is important, therefore, is for us to continue to be vigilant, and our healthcare systems really to continue to exercise that level of control to see whether or not we can actually continue to control this disease. If we fail to do so, either by a late diagnosis and inability to ring fence people spreading the disease from one person to another in the community, that's where your numbers go up. And if it goes up, it doesn't necessarily mean that we can't stop it, but it makes it even more challenging as the numbers go up.
So if the numbers do go up, Yisin, perhaps you can tell us, is our healthcare system sufficiently robust to cope with maybe if we have 300, 400 cases every day coming up? Do we have enough beds? Do we have enough doctors? Do we have enough nurses, ventilators, like Tiki mentioned earlier?
I think it is multi-pronged that we have to put in order for us to be able to cope with these situations, be it in the community or be it in the hospital setting. So I just want to go back to the fact that, in terms of the strategies that we have put in terms of the prevention, certainly, it is multi-layer. And yet, with this multi-layer kind of preventions, we continue to see cases that is coming up. So we do have to anticipate that, we will see cases. We have to get the entire healthcare system ready. But what I want to emphasize is do not let go of these very precious prevention measures, because for us to be able to cope better in terms of the healthcare system coping with the number, all this system will help to slow down the number of cases, and therefore we can focus more on the cases that require management in the hospital system.
Liang, actually, yes.
Question, Salma. I think if there were 300 or 400 cases a day, and touch wood, we never get there, then at some point the healthcare system is not going to be able to cope, at least in the hospitals, and a different strategy is needed. But even before it gets there, I think what we are going to see is that there's going to be impacts on other types of diseases, like treatment of heart attacks or cancer or surgeries. And this is the cost that we will see in extra to just counting COVID-19 cases.
So what you're saying is, if we are so concentrated on COVID-19, people with other ailments may be put on the back burner. They won't get the medical attention that they may need.
Currently, this is not happening now because there's a National Center for Infectious Diseases that absorbs a lot of these cases. But if the case count rises and the beds in the other hospitals, for example, are taken up by COVID-19 cases, then you can see that you'll impact care in a lot of other chronic conditions.
Kenneth, what will happen then to people with heart problems, with stroke?
Yes. So it's certainly a concern that if we spend a lot of our resources, time and energy combating and managing COVID-19, we need to be very careful to make sure we don't forget about patients with other medical conditions whose care otherwise will be compromised as a result of not being able to get access back into the healthcare system and receive the treatments that they actually require. But it's important also to remember that Yisin started off by mentioning that, in fact, the majority of people with COVID-19, in fact, have mild disease, not necessarily having the most severe form of disease itself. And therefore, we may have to relook at our mental model, our paradigms in terms of how we think we want to treat this particular infection. It may well be that when it comes to a situation where there are many cases in the community, then at that point in time we may have to look whether or not some patients with very mild disease that in fact do not require treatment in hospital, whether such patients in fact might be safely managed in the community, with of course adequate measures taking place to isolate them, to make sure that they are safe and not spreading their illness to other people as well. Even when we have patients who are in the hospital, we've taken a very had a very high threshold, making sure that patients are absolutely clear of infection before they actually are discharged from the hospital. And this is because we still don't have a full and complete understanding of the infection. We want to be safe. We want to make sure that the community is protected as well. But as we have a better understanding, if we really recognize that there are patients who in fact have mild disease, then it may very well be that they also do not need to wait until they've completely cleared the infection before they actually discharge. And I suspect many of these considerations took place in China, particularly when they were under considerable pressure managing the precious resources, whether it's general ward beds, ICU beds, ventilators, and so on.
I believe Tiki wants to add something.
Yeah, just to add to the comments on the preparedness of the healthcare system.
Yes.
I think another key priority is to protect Singapore's healthcare workers.
Yes.
Because from what I've seen, this virus has quite a significant nosocomial potential in terms of spreading within healthcare facilities. Probably not as high as it was in SARS, but I believe in China, for example, 3,000 or 4,000 of their health workers have been infected. That's about 4%. So in that sense, I think protecting the health workers is a key priority.
I would add on actually
Right.
to say that we have to protect people in the community, because it is strategies that we have been using. If you are not feeling well with respiratory symptoms, go and see a doctor, stay at home. I think that would be the best in terms of reducing the transmissions in the community.
So everyone can actually do their part in trying to keep COVID-19 suppressed in
That's
Singapore.
right.
It is,
Yes.
yeah.
Right.